Thank you for choosing WellSpan Health for your pregnancy journey. In this video, we will be discussing important information related to your pregnancy. At WellSpan, we have a variety of digital applications which will enhance your pregnancy experience. You can reach out to your provider to learn more. One of those applications is My WellSpan. If you do not already have a My WellSpan account, we highly recommend you get an account, as it will allow you to easily message your obstetric provider, see ultrasound images, make a birth plan, and have immediate access to your newborn's health record after delivery. To start, I want to review a bit about the importance of prenatal health care. It is important that you keep scheduled appointments to maintain a healthy pregnancy. Your provider will ask to see you every 4 weeks until about 28 weeks of pregnancy. You will then be scheduled for an appointment every 2 weeks until about 36 weeks of pregnancy. The last month, you will be seen once per week. Depending on your pregnancy risk factors, these visits may be face-to-face or virtual. Your provider will then check your weight, blood pressure, and the fetal heart rate depending on where you are at in your pregnancy. At each visit, you will be asked to provide a urine specimen. This will allow the provider to check for protein and glucose in your urine. Beginning around week 20, your provider will then measure your stomach to check for appropriate infant growth. If you are healthy and your pregnancy is normal, it is safe to continue or start regular physical activity. Check with your provider if you have any concerns. Exercise has a variety of benefits, such as promoting healthy weight gain, decreases risk of certain pregnancy-related conditions such as gestational diabetes and preeclampsia, and reduces back pain and constipation. We recommend you exercise around 3 to 5 times a week for about 20 to 30 minutes. You should be able to carry on a conversation while exercising and during physical activity. Stop activity if you feel like you become breathless or experience any cramping. A low to moderate level of activity is encouraged, such as yoga, swimming, walking, and low-impact aerobics. Avoid high-impact activities and contact sports, such as volleyball or soccer, as there is a risk of hitting your belly. When lifting, please be aware of the weight that you can tolerate. Do not strain yourself. Any activity that causes spotting should be stopped immediately. Avoid becoming overheated and make sure to drink plenty of water to avoid any dehydration. There are many ways that you can maintain a healthy pregnancy. Growing a baby is hard work. Breast whenever possible. Keep you and your baby safe by avoiding pesticides and harsh chemicals. No amount of alcohol has ever been shown to be safe during pregnancy, so you want to avoid alcoholic beverages. If you are currently smoking, we encourage you to quit, but it is also important to avoid secondhand smoke. Reach out to your provider if you or your partner or family need any assistance with quitting, that we can refer you to WellSpan tobacco cessation services free of charge. Illicit substances or the misuse of prescription drugs are not safe for you or your baby. Substance can have severe life-threatening health consequences for you, the pregnancy, and your newborn. If you have a history of substance use, WellSpan Foundation's Pregnancy Support Services is free for you and your baby. Foundations is a gentle, compassionate, non-judgmental service that can work with you while you are pregnant and up to 18 months post-delivery. It provides resources, support, and baby supplies to those families. If you need help, please do not hesitate. We have a dedicated, confidential line that will connect you with a team member, 717-812-MOMS. This line is available 24/7, 365 days a year. Pregnant women should be careful about exposing themselves to a parasite known to transmit an infection called toxoplasmosis, as it can be very serious for your unborn baby. One method of transmission is through cat feces. Do not change that cat litter. Have someone else do that chore for you. Make sure you care for your teeth too. Pregnancy hormones can impact your dental health, and some studies have shown that poor dental health can lead to premature birth. Make sure to schedule your regular checkups with your dentist, and if you need help connecting with a dentist, please let your OB provider know. If not already vaccinated, we encourage all pregnant individuals to get the COVID vaccine. The American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine, the two leading organizations representing specialists in obstetric care, recommend that all pregnant individuals be vaccinated. Evidence supports the safe and effective use of the vaccine during pregnancy. As compared to those who are not pregnant and recently pregnant people are more likely to get severely ill from COVID-19. Pregnancy causes changes in the body that could make it easier to get very sick from respiratory viruses like the one that causes COVID-19. Talk to your provider if you have any additional questions. Additionally, during flu season, we encourage all pregnant individuals to receive the flu shot. We encourage those who will be caring for the baby to do the same. This protects baby from diseases before they are old enough to receive the immunizations for them. Both your physical and mental health are key to the health of your baby. Depression is common during pregnancy, affecting about 1 in 10 pregnant women. Some women have depression and anxiety for the first time in their lives during pregnancy or after delivery. Your OBGYN provider will survey you and your mood during prenatal care. Share your feelings and concerns openly with your OB providers. Tell them if you had depression in the past, if you take medication for depression, or if you are feeling depressed now. WellSpan has a variety of supportive services that can make sure you get the right resources for you. If you are ever in a crisis or feel like you want to harm yourself or others, call 911 right away. Keeping a healthy diet is necessary for a healthy pregnancy. Try to provide you and your baby with the healthiest diet you can. Make sure to eat your fruits and veggies. Typically, to support your growing pregnancy, you only need about 300 to 500 additional calories per day. For individuals who begin pregnancy at an average weight, your provider will typically recommend a 25 to 35 pound weight gain. This recommendation may be different for patients who are overweight prior to your pregnancy. Talk to your OB about what is right for you and your body. Eat 3 medium or 6 small, well-balanced meals a day and drink lots of water. We recommend at least 6 glasses of water per day. Limit the caffeine you get each day to less than 200 milligrams. This is about the amount in a cup of coffee. Avoid eating raw or undercooked meat or seafood and ensure fruits and veggies are washed before consuming. Try to avoid artificial sweeteners and foods high in salt or preservatives. Seafood has great benefits to your pregnancy diet. However, limit intake and avoid items high in mercury like shark, swordfish, king mackerel, and tilefish. You should take a prenatal vitamin every day. Your provider will give you a list of over-the-counter medications that are acceptable for use in pregnancy. Please do not take ibuprofen or Pepto-Bismol unless directed by your care provider. You may take Tylenol for pain. Please check with your provider prior to starting any new medications, including any herbal supplements. There are many common discomforts of pregnancy, including fatigue, backache, acne, constipation, and breast soreness, among others. You may have some of those discomforts now, and some may develop as your pregnancy progresses. Morning sickness or nausea and vomiting is a common discomfort of pregnancy and can actually happen at any time of the day. It is experienced by as many as 7 in 10 pregnant women in the first 3 months of pregnancy. If you are experiencing morning sickness, here are a few things that you could try. Keep a few snacks like dry crackers next to your bed. Keep your stomach from being empty by eating small, frequent meals. Avoid spicy and fatty foods and smells that upset your stomach. You could also try by taking your prenatals at night. Ginger ale, tea, or candies may also relieve morning sickness. Most babies are born healthy. However, approximately 3 to 5% of babies are born with major health concerns, such as genetic condition or a birth defect. Non-invasive prenatal screening, or NIPS, is a way to screen your pregnancy for a few genetic conditions, including Down syndrome, trisomy 18, and trisomy 13. All 3 of these conditions are caused by extra genetic material and cause health problems for your baby. These conditions typically happen randomly, and there is often no family history. NIPS can be done anytime after 10 weeks of pregnancy, and it involves only a blood draw from you. There is no risk for you or your baby. NIPS can also tell if you're expecting a boy or girl. In doing so, the lab will also be able to tell if you or your baby is at risk for a few genetic conditions that involve the sex chromosomes. Results are typically available in 1 to 2 weeks. Most insurances cover NIPS. Labs also have affordable self-pay options if your insurance would not cover this screening or if you have a high deductible. Another screening method is a first trimester ultrasound, which is typically done between 11 and 13 weeks to evaluate baby's early anatomy and growth. We get valuable information early in the pregnancy by doing both NIPS and the ultrasound. Human milk provides many health benefits for both mother and the infant. The World Health Organization recommends that infants be exclusively breastfed from birth to 6 months and then breastfed alongside age-appropriate complementary feedings for 2 years and beyond. At WellSpan, we strongly support breastfeeding and provide lactation services in both inpatient and outpatient settings to help you achieve your breastfeeding goals. In addition to providing outpatient lactation services after hospital discharge, WellSpan breastfeeding services also offer prenatal breastfeeding consultations. The consultation is beneficial for expectant women planning to breastfeed and/or planning to use a breast pump. We strongly encourage parents to take childbirth classes. The available classes will help you prepare for labor, birth, and postpartum. In addition to classes about labor and birth, at WellSpan we offer classes in baby care, breastfeeding, and infant safety. The classes are offered in person or via Zoom with a WellSpan Health registered nurse. WellSpan Health also offers online classes that can be completed at your own pace. The online class is also offered in Spanish. We encourage you to register at wellspan.org before your 5th month of pregnancy. Also check out virtual tours of your birth facility. During your pregnancy, you may be referred to maternal fetal medicine. The reasons for this referral may include ultrasounds, non-stress tests, preconception counseling, prenatal consultations, genetic counseling, or diabetes counseling and management. Despite the referral to maternal fetal medicine, you will still receive routine prenatal care at your WellSpan OBGYN office. Please reach out to your OB care provider if you experience any of the following warning signs: cramping in abdomen, bleeding or spotting, sudden gush or steady trickle of water from your vagina, leaking urine when you cough, sneeze, or move, burning, sharp, or painful urination, severe or constant headache, blurred vision, sudden or significant swelling in face, hands, or feet, persistent vomiting, fever, chills, or rash, decrease in fetal movement, signs of preterm labor. If you experience these warning signs, it is important that you call the office. My WellSpan portal messages should only be used for non-urgent concerns, as the portal is not monitored outside of the office hours. You may continue to call your primary care physician for any non-pregnancy related symptoms, such as cold or flu symptoms, cough, or asthma. Congratulations on your pregnancy. Thank you for choosing WellSpan OBGYN for your pregnancy care. We look forward to working with you.